Chapter 2 is Specimen Collection. 73. A term that means syringe is non-evacuated blood collection system. 74. Specimens for which of the following tests must be collected by syringe? ABG, which means arterial blood gas. 75. On which of the following patients would a phlebotomist most likely choose a syringe to perform a venipuncture? And the answer is 14-year-old, 46-year-old, 53-year-old, 85-year-old, and the answer is an 85-year-old grandmother. 76. On which of the following patients would a phlebotomist most likely use a syringe to collect a blood specimen? Would it be a woman who had a mastectomy, a woman who just suffered a miscarriage, a man who just underwent surgery, or a man with an heparin lock? The answer is a man with a heparin lock. 77. The closed system that is composed of a needle, a holder, and a tube containing pre-measured amount of vacuum is the evacuated blood collection system. 78. Which of the following needle lengths is most commonly used for adult venipuncture? And the answer is 1 and 1.5 inches needles. 79. What criterion does a phlebotomist use when selecting needle gauge prior to a venipuncture procedure? The lumen size of the patient's vein. 80. Evacuated tubes are manufactured in a range of sizes. Which of the range of volumes listed below most accurately reflects available sizes of evacuated tubes? And the answer is 2 to 20 milliliter. 81. An evacuated tube contains clot activator and serum separator gel. What color is the Hemogard closure? Gold. 82. An evacuated tube contains thrombin. What color is the Hemogard closure? Orange. 83. If an evacuated tube contains heparin and plasma separator gel, what color is the Hemogard closure? Light green. 84. Which of the following blood collection devices is manufactured with a rubber sheath? Multi-sample needle. 85. Which of the following additives is found in a red stoppered evacuated tube? None. 86. Which of the following additives is found in an evacuated tube with a green conventional stopper? Sodium heparin. 87. Which of the following additives is found in an evacuated tube with a gray conventional stopper? Sodium fluoride. 88. Which of the following additives is found in an evacuated tube with a yellow conventional stopper? SPS. 89. Which of the following additives is evacuated? Which of the following additives in evacuated tubes binds calcium? Sodium citrate. 90. Which of the following additives in evacuated tubes neutralizes thrombin? Sodium heparin. 89, just so you could remember, I'm going to remember this. So which of the following additive in the evacuated tube binds calcium? Sodium citrate. Just picture sodium and picture rate. When you rate something is collectively how many people rate it. So think about sodium citrate as binding. And 90, which of the following additives in evacuated tubes neutralizes thrombin? Just think of sodium, which is salt, and think of heparin as I was going to say running away, but that's not going to work. It neutralizes it. So think about hep as helping. So to help it. And when you help somebody, help balance, right? So think about it that way. Which of the following additive in evacuated tubes neutralizes thrombin? Sodium heparin. 91. Which of the following evacuated tube stoppers is manufactured with the lowest verified levels of trace elements available? Royal blue. 92. Which of the following evacuated tube stoppers is manufactured with very low levels of lead? Tan. 33. Which of the following additives is found in lavender stoppered evacuated tubes? Remember, lavender CBC. So the additive is EDTA. 94. Which of the following additives is found in an evacuated tube with a yellow conventional stopper? So remember, the yellow is the blood culture, and it could either be SPS or ACD. So the answer here is ACD. 95. Which of the following additives is found in an evacuated tube with a light blue conventional stopper. Remember, light blue is coagulation. Remember, that's the plasma one. So it's sodium citrate. 96. Which of the following additives in evacuated tubes binds calcium? EDTA. 97. Which of the following additives in evacuated tubes promotes clotting? Thrombin. 98. The standard for measuring the diameter of the lumen of a needle is the needle gauge. 99. The internal space of a needle is the needle's lumen. 100. Which of the following needles has the largest interior diameter? Between 18 and 21, which one? The answer is 18. Remember, the smaller the number, the bigger the gauge. 101. Which of the following needles has the smallest interior diameter? And the answer is here is between 20 and 23. The answer is 23. Remember, 23 is the butterfly. 102. Listed below are conventional stopper colors of evacuated tubes. Which stopper color should be used when collecting specimens for analysis that require both a patient's cells and serum? And the answer is red. Remember, the cells and serums. Red is the coagulation. That's the clotting tube. And they clot at room temperature, remember? So you could either use a clot activator or just let it clot at room temperature. 103. Listed below are conventional stopper colors of evacuated tubes. Which stopper color indicates the tube contains silica particles to facilitate blood clotting? And the answer is red SST. So it's a red serum separator tube. That's why it contains silica. (104) Which of the following needle gauges is used most often to perform routine venipuncture? And the answer is 21 and 22. So 21 and 22 gauges. 105. Which of the following additives in evacuated tubes acts as a glycolytic inhibitor? And it's sodium fluoride. So remember, glycol is sugar and sodium fluoride, that's that gray tube that tests for fasting and sugar. Okay, so 106. Which of the following additives in evacuated tubes prevent platelets from clumping? Remember, it's EDTA. Remember, EDTA neutralizes. No, heparin neutralizes. EDTA. What EDTA do again? EDTA. What that do again? Anyway, that's the answer. I think it binds calcium. Does it bind calcium? I don't remember. Anyway, the answer is EDTA. 107. Which of the following additives in evacuated tubes preserves labial coagulation factors? Sodium citrate. 108. Which of the following additives in evacuated tubes produces artifacts residue on blood smears stained with Wright's stain? Sodium heparin. 109. A phlebotomist transfixes a vein during venipuncture. Which of the following specimen characteristics may result? Short draw. So remember, transfix is like you kind of don't go in the vein all the way. It's just whatever. 110. A phlebotomist obtains a specimen from a patient following a traumatized venipuncture. Which of the following specimen characteristics may result? Hemolysis. 111. A lavender stoppered evacuated tube must be redrawn because of clots in the tube. What collection error causes this? Insufficient mixing of additive with specimen. 112. Which of the following equipment would a phlebotomist carry on his or her tray for a skin puncture procedure? Lancet, micro container, and gauze. 113. A potential complication of accidentally puncturing the calcaneus bone during skin puncture, characterized by inflammation of the bone and bone marrow, is called osteomyelitis. So osteomyelitis is the inflammation of the bone and the bone marrow. Now 114, a potential complication of accidental puncturing the calcaneus bone during a skin puncture characterized by inflammation of the bone and the cartilage. Now that one is called osteochondritis. So the bone, the one with the bone and the bone, when you injure the bone and the bone marrow, just think about osteo is bone and my is, just think about marrow. So osteomyelitis, just think about bone and marrow. And then the osteochondritis, just think about the bone and the C for cartilage. Okay? 115. A potential complication of accidentally puncturing the calcaneus bone during skin puncture, characterized by the presence of pathogenic microorganism or their toxins in the blood or other tissues, is called sepsis. 116. An inherited condition that is caused by the body's inability to metabolize phenylalanine is called PKU. 117. Which of the following values are higher in newborns than in adults? Red cell counts. 118. Which of the following blood constituents will increase as the oxygen content of the air decreases? Red blood cell count. And the reason for that is that if you go in, well, if you're suffocating, the red blood cell is going to be more, because that's the oxygen. So it's going to increase to give you more oxygen. So it's red blood cell count. 119. Which of the following values are higher in the morning? We all know that stress level, cortisol levels. 120. Eating which of the following foods can cause lipemic serum in a patient's blood specimen? Remember, lipemic, remember lip means fat, so it's going to be butter. Well, that's my take on that. 121. Which of the following can affect cortisol levels? And the answer is caffeine. Caffeine raises your cortisol level, so it means it stresses the body. 122. Which of the following levels will remain elevated for at least 24 hours following exercise? The answer is CK. I hope you know what CK means. Cardio something. 123. A patient is being treated with a thiazide diuretic. Which healthcare professional is responsible for recognizing potential drug interferences with test results? Physician. 124. Changing a patient's position from supine to standing will cause which physiologic change? Water will filter from the plasma to the tissues. 125. During pregnancy, the increase of body fluids may cause a patient's RBC count to decrease. Because remember, blood is 55% plasma, and plasma is 90% water. So if the body fluid increase, of course the red blood cell count going to decrease because you don't want to whatever. Anyway, 126. Which of the following patient conditions may cause a transient elevation in white blood count? Result. Stress. Remember, when your stress level is high, your white blood cell, which is the infection cell, come out because it's whatever. 127. A new field of medicine that deals with the study of interaction between the brain, endocrine system, and the immune system is called psychoneuroimmunology. 128. What method of blood collection is preferred for infants? Skin puncher. 129. Specimens for home glucose monitoring are routinely collected by skin puncher. 130. Specimens for which of the following patients should be drawn by skin puncher? And it's a bunch of things, but the answer is an oncology patient, which is ONCOLOGY, oncology patient for a white blood cell count and platelet count. 131. Why is skin puncher preferred over venipuncher for infants for collection of blood specimen? It prevents anemia. 132. Because remember, they're tiny, they don't have a lot of blood. 132. Which of the following tests is most commonly performed on skin puncher samples? PKU. You just gotta know what PKU means. 133. Which of the following collection procedures will yield a specimen composed of arterial, venous, and capillary blood? Skin puncher. 134. If a skin puncher site is warmed prior to blood collection, the specimen is said to be arterialized.